Hey, it's me, Dr. Daniel, and in this video, we're going to be talking about herniated discs in your neck. Hey, it's me, Dr. Daniel, and in this video, we're going to be talking about herniated discs in your neck. So a cervical herniated disc occurs when the inner portion of a disc in the cervical spine or neck ruptures through the outer wall of the disc. In the cervical spine, there are 6 discs that lie in front of the spinal column and connect each of the 7 bones of your neck. Each disc is made up of a soft inner gel-like material called the nucleus pulposus that is encapsulated by a series of tough outer fibrous bands called the annulus fibrosus. The discs provide cushioning between the vertebrae at each level while allowing for a great deal of motion in all directions. At the back of the spine, at each level, a nerve root exits the spinal canal and travels down through the neck, shoulder, and arm, and into the hand and the fingers. And when a cervical disc herniates, it can impinge on or cause inflammation near one of these cervical nerves, which of course then causes pain and other symptoms to radiate along the path of the nerve. In the cervical spine, discs tend to herniate to the side or laterally, causing irritation to a nerve root on one side. The 2 most common levels in the cervical spine to herniate are the C5-C6 level and the C6-C7. Treatment for a cervical herniated disc should really begin with non-surgical options, such as chiropractic physical therapy and soft tissue treatments. And if the problems do not resolve, then of course you can proceed to injections or surgery. That said, 98% of our cases that involve herniations do not need surgery. So if you or someone that you know has a cervical herniation and is looking for a non-surgical solution, please contact our office today so we can determine the best possible approach for your care.